Hi, my name's Dr. Ross Hauser. Thank you so much for watching. It's kind of odd, but one of the things that I really enjoy taking care of is people who have really strange sensations. So it's actually one of my favorite topics because a lot of people have these unusual sensations. Like one of the unusual sensation is troubling temperatures. Like there's people that have fevers, or they have the sensation of having a fever and nobody has figured out the cause. And then another sensation that people have is like what a person recently told me was crippling fatigue. And I think that is just like a really good definition. So today I'm going to talk about, sleepiness, crippling fatigue, and I'm going to present a case where the person also had temperature problems and fevers and nobody could figure it out. So if we could go to the next slide. Yeah, so strange sensations and intense desire to sleep. Like this is actually a quote from a patient. My worst symptom is an intense desire to sleep. I have suffered with it for 8 years. Even today I did a teleconference on a person that was on Adderall. Like people will take stimulants, like they will do anything to try to feel better. The case that I have in front of me, basically from 2012, the person has had like an intense desire to take naps and sleep. It doesn't matter the amount of sleep that this person has, like they never ever feel refreshed. And the interesting thing was that intermittently this person also had very high fevers. Like they would have high fevers anywhere from 103 to 104 for days at a time. So imagine like if you went to the emergency room and you had like a fever of 103 or 104, like right away they would give you diagnosis like encephalitis and all kinds of things. And believe it or not, a fever can actually just be from cranial cervical syndrome or atlantoaxial or upper cervical instability, which I'll talk about. This particular person, they had multiple sleep studies. They were diagnosed with idiopathic hypersomnia, which of course anybody who knows idiopathic, it means they don't have a clue of what's causing it. The person had functional brain tests which showed global hyperperfusion, which basically means that the blood supply to the brain, or the nutrient supply to the brain, it's just very, very low all throughout it. So if you think about just that, what actually would cause moment-to-moment decreased perfusion, decreased flow of blood and nutrients to the brain? Well, the most logical reason would be that the person has something causing their intracranial pressure, the pressure inside their brain, to be too much, because of course that could be a global thing. And the most logical cause of that is going to be problems in the upper cervical region. Give you an example, like this just reminded me of another teleconference that I did today. The person had a cine phase MRI, meaning that they looked at the flow of the cerebral spinal fluid through the brain, and they showed that there was constriction, there was a narrowing of where the CSF went at the foramen magnum, which is where the spinal cord and other structures enter the brain. Like in other words, there was a constriction there. Well, the constriction is why? Because the person has Atlas or C1 misalignment because of instability, and it's decreasing the CSF space, in the foramen magnum. So anybody who has hypersomnolence, they have excessive desire to sleep, the first thing you want to do is get a really good assessment of the upper cervical region, and the best test to get is called a digital motion x-ray. Digital motion x-ray, of course, would assess for instability in the upper cervical region. And if instability is found, then of course the treatment that we recommend is prolotherapy. Here, going back to the case that I said at the beginning of this, was they had fevers. They just had fevers. Nobody could explain the fevers. I should say a lot of people, like this particular person, got diagnosed with multiple environmental chemical sensitivity, a chronic fatigue syndrome. Some people will get diagnosed with chronic Lyme's or tertiary Lyme's because they're trying to figure out like why the person still has apparent like inflammation in the brain or inflammation in the body. Even one of my teleconferences today, she had an elevated C-reactive protein. It was 10 times normal, and there wasn't anybody could figure out why, and even when she took steroids, it didn't help. So the mechanism, and I had the person on the internet, I told them, why don't you look up cholinergic anti-inflammatory system. So we all know fever is what? Fever often is just inflammation in the body, like the body's trying to mount an immune reaction for some reason. Well, it turns out that the vagus nerve is actually in the body is what decreases inflammation, right? So just inflammation, having too much inflammation in the body can give a fever. But also the vagus nerve can affect the brainstem. So basically it affects the brainstem, and then the brainstem then interacts through this mechanism here in the hypothalamus, and the hypothalamus nuclei, which the hypothalamus is in the middle of the brain, that's what controls temperature in the body. So when your vagus nerve flow is blocked or it's not regulating the body correctly, it's not going to regulate temperature correctly. So you could literally have very low body temperatures or very high body temperatures just because your vagus nerve isn't working right, because that's the main sensor in your body that tells the brain what's going on in the body, including temperature, blood pressure, pulse rate, nutrient levels, like what is the super highway, if you will, that tells the brain what's going on in the human body. Well, it turns out it's the vagus nerve. And that's why you always hear me talking about vagus nerve, vagus nerve, vagus nerve. So even with temperature, if you've had high temperatures and nobody can figure out the reason, and maybe you had diagnosis like this person that you have chronic fatigue syndrome, and I'm not saying you don't have chronic fatigue syndrome, I'm just telling you there may be a cause of your chronic fatigue syndrome that's easily treated, it's treatable, and in that sense you could resolve it. So clearly if you have fevers or you're just so exhausted, like you just can't do anything and nobody can figure out the cause, I'd say come to Caring Medical, get an evaluation, by the various motion tests that we do, because that will reveal the instability. It may reveal that there's a blood flow problem or a brain drainage problem. Then of course get under our care with prolotherapy. Prolotherapy tightens the ligaments that are causing the instability. Then if there's aberrant or damaging changes in the cervical curve that are screwing up this mechanism like vagus nerve function, then of course we do dynamic orthoneurologic correction. And the combination of that is very effective to resolve chronic fevers that are from the neck. Obviously also giving people, of course, vibrant energy instead of hypersomnolence or excessive daytime sleepiness. And that is a lot better than, you know, having 8 shots of espresso or taking Ritalin or Adderall. So yeah, that's a much better option.